almost there. Hi, this is Sally Flashberger with the Wisconsin Board for People with Developmental Disabilities, and it's Living Well Wednesday. We're here at a different time today, so we hope you're going to join us either on Facebook Live or if you have the Zoom link. We are happy to have, we'll be talking about the COVID-19 vaccine today. We're going to go through some myth busters about the vaccine, but we're also going to hear about the work of the vaccine committee and the state medical disaster advisory board. I'm not sure I said that correct, but we're lucky to have our experts back with us. We have Mitch Hagopian from Disability Rights Wisconsin, who sits on the vaccine subcommittee, and Marcia Stickel, who is on the larger state medical advisory committee. So 2 experts here to help us out today. So I'm going to turn it over to Mitch. He's going to get us started talking about the work of the committee.
Well, good morning, everybody. Nice to be here again. Always happy to help out with the board and the Living Well project. Again, I'm Mitch Hagopian. I'm an attorney with Disability Rights Wisconsin. We're the protection and advocacy agency for people with disabilities in Wisconsin. And I am serving as the representative of people with disabilities on the State Disaster Medical Advisory Committee. We call it the SDMAC for short. And I'm on the subcommittee that is developing the priorities for distribution of the vaccine against the COVID-19 virus as that vaccine becomes available. The need, of course, to have priorities for who gets the vaccine is because there is not enough vaccine being produced yet to make it available to everyone who wants it right now. So Wisconsin is receiving, batches of the vaccine. I think we've received around 600,000 doses, or no, we've been allocated 600,000 doses by the federal government. We've received somewhere in the neighborhood of, I don't know, 300,000 or 400,000 doses, and we've actually vaccinated probably about 250,000 people so far. We have a long way to go here. Our subcommittee was assigned the really difficult task of trying to figure out, we have a little bit of vaccine, who's going to get it first, who's second, who's third, who's fourth, who's et cetera down the line. And so far, we have finalized the first group of people to get the vaccine, and that is defined basically as people who are frontline healthcare workers, and that's pretty broadly defined. So it's people in hospitals, nurses, doctors, the people who help out and actually see patients. So the food staff, the janitorial staff, all those folks are covered. And then also the home care workforce is covered because they're circulating amongst people who are in their homes or in CBRFs or assisted living facilities and are receiving care from personal care workers, home health workers, supportive home care workers under IRIS and family care. And just one thing that I think people are not clear about within that group is it does include unpaid caregivers as well. So it's not just, paid supportive home care workers. So if you're an IRIS recipient and you have, participant hired workers, the people you hire and pay to provide care to you, and you also then have other workers, family members usually, who are unpaid caregivers. They're covered in 1A. There's a kind of a big issue in general about this whole vaccine distribution is how do you actually get the vaccine even if you're in one of the groups that's prioritized. And so right now, the group of people that are considered unaffiliated workers, those are, people who don't work for one of the larger health systems, Mercy or Aurora or Gunderson or Mayo or UW Health or any of those places. They're considered unaffiliated workers. And that's pretty much the entire personal care workforce and home health and supportive home care workforce. Those people are should be in touch with their local county health departments, because that's the entity that has been assigned to figure out how they're actually going to get vaccine into the arms of their workers. And so if you're an unaffiliated worker, a participant hired worker, you don't work for anybody, no, not a home health agency or anything. You just are hired as an independent contractor by the IRIS participant. If you want to get vaccinated, you should be contacting your local health department. And in some counties, the IRIS consulting agencies are able to connect people with vaccinating entities. But it's a kind of a pretty confusing mess out there. That's why I would describe the implementation right now. It is hard to, even though if you're in the 1A group as a healthcare worker, it can be challenging to actually figure out a place where you can go to actually get the vaccine. So you have to be persistent, contact your health department, and see what they have to tell you. So that's the 1A. The other group of people that are in the 1A, so that's the people who got the first vaccine, are people in long-term care facilities. And that I think has gone pretty well in terms of making sure that people in nursing homes get vaccinated. And so but it includes more than just people in nursing homes. It includes people in large congregate, CBRFs and even the larger adult family homes. So those people are getting vaccinated through a partnership we have with CVS and Walgreens, the two major pharmacy providers in Wisconsin. And they're arranging to go out to these facilities and vaccinate both the residents and the staff of those care facilities. What the subcommittee just finished its work on is the phase 1B. So as we finish up with the healthcare workers and the people in the congregate long-term care facilities where the infection is rampant and the consequences are horrible for people, that's why they're in the first group to be vaccinated. We're now moving into the second tier of people. And this is a much larger group of people. The first one was pretty big. It was around about 500,000 people were covered by that. The second group, we've finished our work. We're the subcommittee. We made a recommendation this morning at 8 o'clock this morning to send the 1B group that we think the people who should be in the 1B group to the full State Disaster Medical Advisory Committee, which Marcia sits on. So Marcia, I don't know if you listened to our meeting this morning, but here's what we decided.
Oh, I'm eager to hear.
It'll come to you tomorrow. First, we had long discussions, and we made a preliminary recommendation a week ago, I think it was, or a little over a week ago. Last Tuesday. We put that out for public comment. We gave people till Monday afternoon to submit comments. It's like 6 days to comment. We got almost 5,000 separate comments on our proposal. This is a lot of people are very interested in this topic. It was unbelievable. And between, yesterday morning and today, whatever there were 14 or 15 of us on the subcommittee, we literally, somebody on that committee read every single one of those comments. I was in charge of reviewing the comments that related to the group of people with health conditions that we're considering covering. And I read 585 comments, 650 pages of documents yesterday, analyzed them and made a recommendation. So, and some other people, comments in support of grocery workers and food production workers was over like 1,700. So it's just astonishing the amount of interest that's out there on this. So here's what we ultimately decided. I confess I'm sure I'm going to miss some groups because I don't have a document in front of me yet. We just finalized their recommendations, and it's not been committed to writing yet. But here's the big ones. Even before we did anything, the secretary of the Department of Health Services had decided that everybody over age 65 or 65 and older was going to be included in the 1B group. That's a very large number of people in Wisconsin. It's about 1.16 million people. So before we even started our work, the 1B group already had 1.16 million people in it. And then another 25,000 or so first responders, so police and fire were included. So they're already in 1B. So our committee then looked at people with particular health risk, and then other essential workers. That's essentially the group of people that we were trying to figure out which among those would be included in this next round of people to be vaccinated. And for people with disabilities, the most relevant categories that will be included in this group are everybody who is in family care, everybody who's in IRIS, and everybody who is in the Children's Long-Term Support Waiver or the Katie Beckett program, who is old enough to get vaccinated. So that's a pretty significant population, and it certainly represents probably the most vulnerable people out there, because of the level of the care requirements to qualify for any of those programs. We're talking about people who would definitely have what we call the comorbidities or risk factors for COVID, meaning that if you get it, you're going to have a higher chance of having a bad outcome from it. And then plus, so they have those like, the health conditions, diabetes, intellectual disability, Down syndrome, quadriplegia, paraplegia. These types of conditions are rampant among the family care and IRIS populations. And so in addition to having those conditions, which are risk factors, these folks also have been identified by, a third party to need significant at-home and on-hand care. So amongst even the people with high risk factors and comorbidities, this group is even at a more heightened risk for bad outcomes. So they were appropriately included in group 1B. And there's about 77,000 IRIS participants and family care participants. And then there will be a couple of thousand additional people added into that group because young people age 16 and older who are in CLTS or Katie Beckett will also be added to that group. That was an addition made since our proposal. So that's an excellent, it's good that these folks are included. One thing about the younger people, the 16 to 18-year-olds, there will be, obviously, they'll be covered if you're in CLTS or Katie Beckett. The problem is that there's so far only one vaccine that covers the 16 to 18-year-olds, and that is the Pfizer vaccine. The Moderna vaccine, you can't take it if you're under 18. So, and most of the Pfizer vaccine that we have in Wisconsin has already been distributed. So even though if you're 16 to 18 and in 1B or will be in 1B when that gets finalized, you're going to have trouble finding the vaccine. So I don't want to, raise false expectations that there are going to be a lot of the youngest people in this group that will be able to get the vaccine. It's a matter of there just isn't a vaccine available to serve that population. Other people who are covered are people who live in congregate living facilities, so people who are in CBRF's adult family homes. There's a big overlap between this group and the family care population. So, but there's also people who live in those settings who are not affiliated with family care and IRIS, and they will be eligible in 1B. Amongst the frontline workers, essential workers, committee recommended that grocery store employees and food production workers be included in this group. We recommended that public transit workers, and in fact, public transit workers be included because those are critical to getting people to and from medical appointments and to outlets for food purchase. And And then the biggest group, of course, thanks Sally for reminding me, are educators. So the entire, basically the entire K through 12 education system, 160,000 or so employees will be covered in this group. So all the teachers, the janitors, the administrative staff, because everybody in a a elementary school or a high school runs into kids. You just can't avoid it when you're in a school system. So they're all included in that group because they're going to see it. So and the idea behind that is we can't vaccinate the children for the most part. So we need to the people who teach them need to be protected from the ravages of this disease, and we need to get kids back into school to improve outcomes, educational, and to protect the people who are doing it. One question we have is, when will this phase 1B group start? It already has started. The first responders have been included into it. Everybody over age 65 will start next week. And then when the other people that are in this group move in, it's not exactly clear. You need to pay attention. The Department of Health Services, after assuming they approve essentially what we agreed to, and I think there's a pretty good chance they will, there'll be minimal modifications to it. Then what will happen is the secretary is going to decide when we've vaccinated enough people in the 1A group and the top of the 1B group, which is age 65 and first responders. And then she'll determine when we can open it up to bigger parts of 1B. The committee itself, we did not make a recommendation as to what order these next group of people will be in, and we have no control over the date at which we actually move to 1B. So I mean, there's other people included in this group. We did recommend to the full committee that they cover people who are in prison, because people who are in prison are at high risk of getting the disease. Transmission rates are incredible in the prisons and in the jails, and they live in congregate facilities. That's probably the most congregate facility you could possibly live in, and it's a matter of ethics and morals that we don't treat people who are prisoners just because they have in the past committed crimes differently from a health perspective than we treat other people who are living in facilities where risk of transmission is high. So they're included in the group as of now. We'll see if that continues. Are there any other questions from the group, or Sally or Marcia? Any questions?
I think someone had posed a question like, how long will it take? So maybe talk about the number of people, because it is quite a lot.
Right. So the phase 1B group, if you just look at the raw numbers for each of the subgroups that we're covering, it's about 1.6 million people. Now, it's not that big because there's a lot of overlap. Once you cover everybody who's over 65, you've covered a huge number of the people who are in family care and IRIS. So even though there's 77,000 people in family care and IRIS, they're not on top of the 1.16 million people that are covered because of age, because about 30,000 people in family care and IRIS are covered because they're 65 and older. So really the family care and IRIS group that we add to that is more like 50,000. And that group's even reduced even further because a bunch of those people are in CBRFs or adult family homes, and they're covered under that group. So, I mean, I'm going to just guess, but the group is, the full complement of all those groups is 1.6 million. We're probably talking about 1.3 or 4 million that are in that group. It's not quite 1.6 million, probably 100 to 200,000 less than that. But it's big. And so far, we don't have enough vaccine to come even close to vaccinating everybody. So everybody be patient. The state, is faced with a very difficult implementation plan. And I think I can tell you that people at the Department of Health Services are working as hard as they possibly can. County health departments are doing the same thing. We are all in this together. Be patient, social distance, do everything Marcia's about to tell you to do. And when you do get a chance to get the vaccine, take the vaccine if you can get it so we can get through this thing. Thanks.
All right, that's great. I don't see any other questions. I think that was a great update on the committee. I too did watch it this morning, and just looking at all the hard work that they had to do in such a short time was really incredible. I'll post the link to that so people can read the comments if they choose to. There are a lot, but they had them all posted up on the website. So thank you so much, Mitch. All right, we're gonna turn it over to Marcia. Oh wait, somebody has a question. Let's see.
Hi, can you hear me?
Yeah, can you post it in the chat? Would that be okay?
Oh, of course.
Okay, thanks. I'm going to turn it over to Marcia, but we'll come back to the question once we get it. So Marcia, if you want to take it over, I think Caitlin's going to share a document that we've been kind of compiling as we go.
Okay, you can see here a document that I think is really handy to have, which gives you an idea clearly of, is there a time when you should wait? So we are encouraging strongly, and you will hear me say this over and over, to have the vaccination when it's available to you. But there are some reasons why you should wait, and those are listed here in this table. And it's just really pretty clear cut. So some of the things are similar to what you would be told if you were going to have a flu shot. If you don't feel well, you need to wait until you are feeling better. So if you have a cold or you have the flu or some other thing, then wait until after that has subsided. If you've been exposed to someone with COVID-19, you need to quarantine and wait until the quarantine has ended before you would have the vaccine. If you have had COVID-19, there's lots of questions about this, and that's part of the myths as well. But this is really clear cut. If you've had a positive test, so you know you've had COVID-19, then wait until your symptoms are gone and count out 90 days before you have the vaccine. And that's more because it's widely thought by scientists and doctors that your having had COVID-19 will keep you from getting it again for 3 months. And therefore, it makes sense to let other people who haven't had COVID-19 get the immunization first. And also if you've had a flu vaccine or a different kind of vaccine in the last 2 weeks or 14 days, that's another reason to wait for 14 days after that. And that was something I didn't know until I got this CDC guidance. One question that has been permeating through the news and sometimes in the misinformation that comes available by social media is about the allergic response to the COVID-19 vaccine. And so you'll see in this table, the second from the bottom, if you have a known severe allergy to any of the COVID-19 vaccine ingredients, then don't have the vaccine. Now, this is very clear, a known allergy to one of the ingredients. It is available if you Google it or request, there will be a list of all of the ingredients in each of the vaccines, either the Pfizer or the Moderna. But what has been thought to be the component that has caused allergy response is polyethylene glycol or polysorbate. So those are the two that if you know you have an allergic response and I'm talking a severe allergic response to either of those, polyethylene glycol, sometimes called PEG, P-E-G, or polysorbate, then you do need to put off getting the vaccine. Having, and we'll talk about this again with the myths, but having a little bit of a redness on your arm or your typical fever, achiness, feeling a little punk for a couple of days from the vaccine does not mean and has nothing to do with having an allergic response. An allergic response is a severe reaction. And there have been a few people who have had that kind of a response. But in the data I read this week, about 1 in a million people who have had the vaccine, either of them, have had a severe allergic response. So that's very small amount of people. But if you had the first vaccine dose and you did have a severe allergic reaction, then you want to just postpone having the second one. So those are all of the categories listed here. And I didn't cover the very first one, which isn't as common. Not very many people probably have had that. It says if you received a passive antibody therapy treatment for COVID-19, and that is through an intravenous medication. So you would be well aware if you've had that. Then you would wait for 90 days because again, it's presumed that you won't have a problem with getting COVID since you had that treatment. Okay, any questions on that table? I think it's quite clear cut. It's very nice to have that so you can understand any valid reasons to delay having the vaccine.
Yeah, no questions. And we will post the link to this document in the chat and also on our Facebook. It's going to be on our website. So we will post this.
Good.
But no questions on that in particular.
Okay, good. So one of the things that I was asked to discuss is any medical updates. And wow, things keep changing, as we said they would, even in December. There is a concern about a new variant. You may have heard about it. I don't want anybody to freak out because it isn't any more virulent. That fancy word just means you're not any more likely to die from it. However, I do want you to be very aware that it's a very, very good reason, in addition to everything we've discussed, why when you have the opportunity to get the vaccine, you should get it. The vaccine does still work against the variant coming from the United Kingdom and from the one from South Africa. It's the one from the United Kingdom that's now wending its way through the United States. It is, however, 50% more contagious. And so it's even going to be more important to either get the vaccine or to maintain all of the things you need to do, like wearing a mask and keeping your distance from others and avoiding group gatherings. By March, this variant is expected to be dominant throughout the United States. Another good news medical update for our state of Wisconsin. I sat through and listened to the whole press conference yesterday afternoon by DHS, and they emphasized there are now 1,200 vaccinators in the state of Wisconsin. So as you may know from the media, people have been very disappointed at the speed or the lack thereof in getting the vaccination, getting the vaccine from the containers into people's arms. And so having an increased number of vaccinators is a big step. However, as Mitch already said, we don't have enough vaccine. That was discussed at length yesterday. We get about 70,000 doses per week. And you heard about all those big numbers from Mitch. when asked by reporters, how long is this going to take just to get through phase 1B? And primarily they were talking about the 65 and older group, as well as first responders. And she was saying, give us a couple of months, realistically, a couple of months. So it is going to require patience. Now, I don't want to confuse anybody, but there is hope also in that there's 2 other vaccines that are on the doorstep. They have done the work of going through all of the testing. They have not been scrutinized yet by the CDC and by the other independent professionals who look over every bit of data as they did for the Pfizer and the Moderna vaccines. So that process has to be done before it can be given an EUA, which is a temporary approval for distribution. However, it gives us hope because when/if they're approved, that will greatly increase the amount of vaccine that will be available. So those are really the medical updates. We know that it changes really almost every week. So I think we want to jump into the myths. So you see some facts here. Who will pay for my COVID-19 shot? And that's something I want to address right here. It's free. Now, we all are suspicious of anything when it says that it's going to be free, but truly, if you have insurance, probably your insurance will pay for it. But if you don't have insurance, it will be no charge. You want to share that with anybody who may think, I can't have the shot because I can't afford it. So let's see what else is on there. Things we've talked about before. How will I feel? We've talked about that. And where can I get it? Okay, that is an interesting situation. We've already heard that it might be tricky. You have a clinic, a doctor, you can check with your doctor to see if they have the vaccine. They're setting up mobile vaccination sites. I don't know how much of that has been implemented. I know that was the plan started last week. I did see that the Alliance Center in Madison is now doing some immunizations, some vaccinations. And so it's probably dependent on, as Mitch said, your local health department. And the mobile vaccination sites will include National Guard assistance. There is also hope, as there's more vaccine, that there will be more clinics in process and on big sites like in the stadium and Miller Place or Miller, whatever, the Miller Stadium, whatever it is. But not yet, because there's not enough vaccine to even promote and give it. If there's not enough vaccine, there's no sense in setting it up. So here we are at the myths. I think one of the first was people just felt like, oh, it always took years before, how can this possibly be real, that the vaccine got done, completed so fast. So as it mentions here, there was a huge amount of money that was dispersed. So companies took the risk because they knew they had that money to go ahead and pursue getting the vaccine made and tested. Also, for the 2 that we currently have, the Pfizer and the Moderna, I've read some very fascinating articles about research that was done well in advance of their even going, before they knew there was going to be a pandemic, on the mRNA way of making a medicine. And they were working on it for other purposes. And so they had a lot of the basic research and planning done on how to use it. And then the pandemic came, so they were then able to utilize it almost immediately to start working on it once they understood what the COVID looks like. When you have something like that, and we have to give credit to China, because they were the ones who broke it down and said, these are the components of this virus. And so then they were able to work with it. Also, as it says there, it has been scrutinized. It's scrutinized by the Food and Drug Administration. It was scrutinized by a whole lot of independent experts, and they determined that it's safe, which then goes to the next myth. There are bad side effects from COVID-19 vaccine, as I already said. Not really. There are side effects that you feel because your immune system is getting busy. So as with flu vaccine or others, you may get a headache, you may get sore at the place where you had the immunization. You might get chills or fever, body aches, or just feel kind of punk for a couple of days. And that means, yay, that means it's working. Most of us have had other kinds of immunizations, vaccines, and we know that is part of the process. So the next myth, more people will die of side effects from the COVID-19 vaccine than the number of people who die from the virus. As it states in that fact, dying from a vaccine is very rare. 1 in a million chance. And if you get COVID, it's 1 in 30,000. So that is a big difference. You're much, much higher risk of getting severely sick with COVID or dying than you are from the vaccine. So that just needs to be out there really very clearly. Then the next one, if you've had COVID already, you don't need to get vaccinated. We went over that already. Right now they're saying wait 90 days after your symptoms end. But then you should get vaccinated because it's expected the vaccine is going to protect you for longer. And once you get the vaccine, you are immune for life. You noticed I said for longer, I didn't say for life. Most vaccines do not last for your whole lifetime. So we are not sure yet how long this vaccine is going to keep you safe. We should expect that there's going to be more COVID-19 vaccinations in our future. They are continuing to gather data from people in other countries that are getting vaccine to see how long it lasts. And there will be lots of information in the United States as time goes on. Oh, this is one that I would put in neon and in bold. You can stop wearing a mask after you get vaccinated. No, no, no. You must continue to wear a mask. And I know that's very disheartening, but it's going to take a while. Even when you get the vaccine, it takes a while for some effectiveness to start. And then you need to have the second dose after a month, 3 weeks Moderna, the other way around, 3 weeks Pfizer, 4 weeks Moderna. But then you still need to wear a mask because of the society around us. It's not clear how long that's going to be, but just plan on wearing a mask, but be thankful because you know that you are not going to get horribly sick from the virus. The vaccine has the coronavirus in it and will make people sick. That is absolutely not true. It's different, but really it's not that different from all current vaccines. No vaccines now have just a plain virus that they give to people so that they get sick from it. And that just doesn't happen. But with these two, it's a messenger. It's a messenger to your body that says, okay, you need to make this little spike. And then when your body makes the spike, which is on the virus, looks like the one on the virus, your body says, oh, danger, danger. And if you should get the virus into your system, your body's prepared to zap it and to keep you well. So there is none of the virus that even goes into your body at all. Because of the word mRNA, I think people have gotten very nervous because they know our body has RNA and DNA. Your DNA is in the center of your cells, and it's in a protected site, and this little mRNA message that comes to the cells is only in the perimeter. There is no way that it reaches the DNA. You do not need to worry. Nothing's going to change you. You will not have any changes in your body except being ready to fight the virus. Next myth, you do not need to get both shots. Yep, you do. So when you commit to getting the first shot, you need to commit that you're going to have to go back and get another one. The second shot is key to being sure that that you have really good protection. The first shot, it gives you some protection, but not enough. So you must plan to get both shots. And if you get the flu shot, guess what it protects you from? The flu. It absolutely does not protect you from getting COVID-19. And they're two very different kinds of virus that give you flu versus COVID. And frankly, for most people, COVID is far more dangerous. So yeah, so that pretty much covers that. That's the end of the myths, I think. So we've talked about where to get a shot. We've talked about you're going to have to be really, and Mitch covered that as well. I'd really, really like to discuss any hesitancy that there could be out there about getting a shot, particularly for people of color. For African Americans, there's been a lot of suspicion and worry about getting an immunization. And we want to recognize why. The history of mistreatment or lack of medical treatment for people of color is out there. It's very clear from way back from the Tuskegee time and other historical abuses. But also, I've seen it myself, that when someone goes into, say, an emergency room and they're acting out of it, if the skin color is black, there may be a perception the person is high on drugs. And that is the first thought, and sometimes treated accordingly. Or that if the person's been injured, that it's from criminal behavior, or if a person's complaining about pain, whether they're going into their doctor's office, but especially if they're going to an emergency room, that it's faking it to get drugs. So when people have experienced this over and over through the years, through generations, we can understand there is a lack of trust when they hear something about, okay, you need to take this. This is what you need to do, because is this something they can believe? And if they go in to get an immunization, will they be able to get it? Another issue for people who may be struggling because they don't have medical insurance, maybe they've been laid off, or maybe they weren't able to have insurance because of their work. They often have not developed a trusting relationship at a clinic or with a doctor or a nurse practitioner. And so then they don't have anybody that they feel comfortable that they can depend on, that will give them the straight information, and that they can go in without feeling awkward and nervous. So we need to understand about that. I know there have been efforts made in the media to show individuals who are Black or other colors various ethnic backgrounds getting immunizations, getting the vaccination to try to help people to feel comfortable. I would also encourage any of you who may fit in any of those categories to really encourage others to show by example why it's okay to have a vaccination. People who are not citizens may also have a deep fear because you do get asked questions when you are going to be vaccinated. But one of the questions is not whether or not you're a United States citizen. And it doesn't ask, where do you live? Or things that would cause you to be at risk of being sent back to a country of origin. We already talked about the cost of the vaccination. And I think, we want to emphasize again, this really is free. So people shouldn't hesitate to get the vaccine. Still another is if a person is working on a shift job, you're working hourly, getting the time off is a challenge, and it's getting the time off times 2. So you need to take maybe a 2-hour cut out of your day. It's really hoped, and I know that some companies have already said that if people go to get vaccinations, they will not have pay docked. Instead, they will get reimbursed for the time it takes to go get the vaccination. So I strongly hope that that will be the case for grocery stores, for Walmart, for wherever people are working, for factories, so that that isn't a roadblock for people. And then there's one other aspect, and I have seen this even among people who've been refusing the vaccine, is they feel, especially if they're younger, oh, I'm not going to get very sick from COVID-19, so why should I go through the hassle and the time to get an immunization? And so that is something that hesitancy is there. I'm not sure how we're going to get past that. Again, I think there needs to be strong encouragement. I saw a troubling report today that half of the caregivers in the state of New York at skilled nursing facilities had refused the vaccine. And so that's very troubling. I'm not sure how we're going to get past that. Social responsibility is the key here. But I don't say I have the answers. I just want to raise the awareness. If you're a young person and you know anybody who is 65 or older that you love, get the vaccine. Get the vaccine for them. Okay, so here we go. Basically, we've already said, you've got to continue. As tired as you are of all the restrictions, you've got to continue them until we have many, many, many more people who have had the vaccine. Herd immunity is not expected, and that's like 70-80% of people who no longer will get it. Not expected to happen until probably the end of September 1st is what we're hoping for, the end of August. So plan on it. Avoid those great spreader events, social gatherings, funerals, weddings, parties, bar hopping, restaurants. They're dangerous places. They're places people want to go to. Church services, dangerous places. It's not worth it. We really are in the countdown now where we can beat this thing. We can stay well. We can stay healthy. We can get past this, but it still means being diligent. Get your mask on when you leave the house. Get your mask on if you're going to be walking close to other people. But in general, outdoors is great. If you know you can be outdoors and you're not going to be right close to somebody that you don't know, no mask. So yesterday I walked in the snowfall. It was grand and no mask. But other than that, get that mask on, keep 6 feet distance. Remember, put your arms out, both sides. That's 6 feet. That's what you want. 6 feet from anybody else that is not part of your family group or pod, as we sometimes call it. So, any questions?
There weren't any questions, but again, I think just so important that message. You brought us such great information. Somebody did comment, incredible information that we've shared today. I think, talking about the hesitancy, I did post in the chat. One of our board members shared an article and a video about tribal members, and I did watch the video. It was a little bit long for today, so I encourage people to take a look at that. It was interesting about a tribe in Washington State who was receiving the vaccine. There was a question that came in from Mitch from Margaret, and we did answer that in the chat, but it was about contacting, if you are an unpaid family caregiver, encouraging you to contact your public health department. That's probably the best place to start to try to get that information. You would be considered an unaffiliated healthcare worker. That's how you might want to phrase it. So contact your public health department, and I would say from my own experience, keep contacting them because they're busy, but it's not where you just call up and you're going to get that answer. So make sure you're kind of continuing to ask the questions and reach out. This was great. I don't see any other questions. Oh wait, maybe there's one in the chat. Let me just look. No, just again, lots of praise for the presentation today. We will plan to have our experts back next month if they'll be willing. So we're going to continue kind of down this road of giving you all the information we can related to the vaccine. We will I also put the document in the chat on both Facebook and the Zoom, but that will be available on our website, and we will be updating information. And I just encourage people who are getting the shot to post it on their social media or someplace so people can see that you are getting the vaccine and that it's okay. We hope to include some self-advocates in the next round. We know a few that have gotten their vaccination, so we're hoping that will be next month when we do our Living Well Wednesday. But otherwise, thanks for joining us. And that'll be the end of our presentation today. And we'll be back at 11 next week at our regular time. And we're going to be talking about voting. So join us for that and talking about the upcoming primary. All right, great.